So this panel that we're calling up right now, if I could have everybody's attention, please. First, I want to introduce Commissioner Epps from the Department of Corrections from Mississippi. Commissioner Epps was appointed to his position in 2002. He has a long history of working in the Department of Corrections in Mississippi, a national leader on corrections, just recognized this year for the Outstanding Award in Leadership, the Frankie Award, which I know is the big deal among all the corrections directors. So Commissioner Epps, thank you for being here. Director Justin Jones, a member of our board of directors from the Council of State Governments Justice Center, the Director of Corrections from Oklahoma, another one of the longest serving directors in the country. He chairs ASCA's Reentry Committee. Commissioner LaDonna Thompson is the Commissioner of Corrections in Kentucky. She also began her career in corrections, as have the other panelists.
Excellent job.
She has been Commissioner of Corrections for several years, and some very exciting things happening this legislative session in Kentucky that I know Commissioner Thompson was a key part of, and we look forward to hearing about those. You've already met Director Wall and Representative Pat Colloton. The last person that I want to introduce is Mike Lawlor, who is the Undersecretary of the Office of Planning and Management, which to folks outside of Connecticut sort of sounds like a mouthful, and what's that? People inside Connecticut know he's the crime czar. He's the governor's go-to person for crime policy in Connecticut, all headquartered out of the state budget office, which all of you know is the place where the key decisions get made. Before becoming the Undersecretary, Mike Lawlor was one of the longest-serving Judiciary Committee chairpersons in the country, chair of the Judiciary Committee in Connecticut for almost more than 15 years, Mike, is that right? 16 years. So please join me in welcoming this terrific group of panelists. The first thing that I want to focus on is so we've all been talking about recidivism and corrections and the director of corrections. And you know, I know that we talk about courts, we talk about community corrections, we talk about all these systems that have an impact on recidivism, and yet in the crosshairs in this conversation constantly has been the Department of Corrections and the Commissioner. And so I think the first question that we want to ask, and we asked this in our survey, and interestingly, about half the directors said that they feel accountable as it is for a statewide recidivism reduction effort. And so we want to just get a sense of, you know, from the director's perspective, do you think it's right? Do you think it's appropriate that the Director of Corrections be accountable for recidivism reduction in a state when it actually relates to so many other agencies? And Director Jones, I wanted to ask you that question first.
Well, it is now 10:50, so we'll get that out of the way. But absolutely, I do believe that correctional directors, commissioners, secretaries should be held accountable and have historically been held accountable simply because in the early years after Attica, et cetera, corrections directors were looked at as the persons that hold all the offenders inside, and therefore recidivism is reflected upon the director. But I think in today's environment, it's incumbent on correctional directors to reach out and collaborate and understand what's going on with other associations and other entities within criminal justice, to include looking at the best practices that's coming out of the American Probation Parole Association and ICA and other associations, and collaborating in maybe non-traditional ways to help reduce recidivism. So even though I agree that corrections directors are responsible, they're also responsible for bringing in all the other collaborators, because you cannot do it by yourself.
And so you think it's fair and appropriate then that the corrections director would be the point person for sort of statewide reentry?
Absolutely, absolutely.
Okay. So then the follow-up question here is, now we're talking about results, right? We're talking about actually making inroads in recidivism. And I know when we asked the survey question, how many states have actually a measurable goal for reducing recidivism, we heard about 1/3 of the states feel like they actually have a target, a goal. It's a very tricky spot to be in, and we're going to put the legislator and the governor's folks on the hot seat in a minute, because they have high expectations, and then I know everyone's frustrated that sometimes the money doesn't necessarily follow. So, you know, are you setting yourself up for failure by setting a goal? Is a goal appropriate in terms of setting a goal for this recidivism reduction effort? Director Jones.
Yeah, I think you do have to set goals. First of all, you have to know where you're at, and then you have to have the best practices and the abilities to implement those best practices. But I mean, you got to have a goal, and you have to be able to at least have intermediate measures to see if you're on the right track to obtaining those goals. And I think Dr. Latessa really kind of got us stirred up a little bit today. And for those of us that have heard him for 500 times, it's starting to sink in a little bit. but definitely, I mean, you know, you've got to have goals. And you've got to be able to measure intermediate steps in achieving those goals to make sure that you're on the right track and have quality assurance involved in that process.
So let me turn to Commissioner Epps. And Commissioner, I remember one of the first times I met you, and I was trying to ask a question. You interrupted me and quoted a Mississippi legislator, a chairperson. I think you said something about a lion. Could you remind me of what you said?
I'd be glad to, Mike. When your head's in the lion's mouth, don't wiggle too much.
So you heard that about sort of the lion's mouth and don't wiggle too much, and I obviously had a deep pause when he mentioned that to me, and I was worried, was I suddenly in the lion's mouth? And so the question to you, Commissioner Epps, is corrections climbing into the lion's mouth and wiggling when they talk about setting a goal? I know in Mississippi, you played point on a major recidivism reduction effort. That's how you sold a major package. Could you talk a little bit about what you had to do to sort of lead that, and was a goal involved? Yeah,
I'd be glad to, Mike. We, as correctional commissioners, secretary, directors, we are appointed to these various positions to lead corrections in our state. There's one of us in each state. And with that in mind, we should be the experts to do what needs to be done. And so in that, who would be a better person to expect to lower recidivism rate, to provide reentry, to collaborate other agencies than Department of Corrections, Director, Secretary, or Commissioner. And so I think this is our responsibility. If we can't pull everybody together, human services, mental health, education, then that's where we may have to ask our governor to get involved to issue an executive order, if that needs be. Whatever you have to do, but I take full responsibility for my system in Mississippi, Department of Corrections, as it relates to the recidivism rate. And over the last 3 years, we've been able to lower it from 32% to 28%, thereby saving several $7 million. And we're going to lower it another 5% within 5 years.
Terrific. Thank you, Commissioner Epps. So I'd like to turn now to our other branches of government. And Representative Colloton, you talked earlier about the tough fiscal times in Kansas, which every state can relate to, I think with the exception of North Dakota, which continues to be doing quite well, it seems, but financially. But in terms of Kansas's budget, you all faced difficult times. Kansas went from reducing recidivism, making some of the biggest inroads in the country, and you faced some tough decisions about continuing funding for those programs. Can you talk a little bit about that situation that Kansas found itself in?
Sure, Mike. And in the legislature, we realized we had averted building additional prisons, that we'd done some great programming, but when the fiscal crisis started to develop in 2009, as legislators, it was so much easier to simply cut across the board all the agencies, rather than single out and decide this social service program, this corrections program need to be retained. So just as a political matter, a 90-day citizen legislature, it was easier to just do across the board 5%, 8%, 10% cuts. Now, that's when we had really excellent programming that was reducing recidivism. And what has become apparent is that if we have a recidivism goal and we can tie this really to public safety, then we can get the legislative will, the legislative orientation to bring back the funding. Our current Secretary of Corrections, Ray Roberts, is championing that in the current upcoming budget fight, but it's with a specific public safety goal that I think we will be able to restore some of the funding that we just, I wouldn't say mindlessly, but that we even-handedly cut from corrections and everywhere else. So I think we are going to restore some of the good work we did, but it will be because we're rallying the legislature and the budget process around a specific goal.
Terrific. Thanks, Representative. Undersecretary Lawlor, I've been to many events where governors outside a prison, in a community, in a church, launch a very public initiative around reentry, talk about the big expectations that they have, all the excitement. After sort of the room's being swept up, and I'm sort of talking to folks afterwards, I sort of say, so how many people is this new program actually going to serve? And I hear, well, we're going to serve about 50 people. And I say, well, aren't there thousands of people sort of coming out of the system? I say, you know, how do we reconcile this perception that, in fact, a lot of these things are sweeping and statewide, yet at the end of the day, these things are somewhat very narrow, serving a tiny subset of people. Can you sort of walk us through sort of the dilemma that often comes up in those situations?
Well, that's for sure, Mike. And, you know, my boss, Governor Dan Malloy, doesn't do it quite like that. He just says, you know, you're the guy, you got two jobs, save a lot of money and reduce crime, and do them at the same time. And so, but when you talk to legislators, no offense, but 'cause I used to be one for a long time, you know, every legislator has their own pet project, their own specific recommendation on how to do that. And I think what our big challenge is now is to convey to everyone, legislators and prosecutors and judges and corrections professionals, parole, probation, everybody, that we have to we have to do this effect across the entire system. It can't be just this or that specific program. And you saw Ed Latessa explaining that a few moments ago, that at the end of the day, we're going to measure all of these outcomes. And in our state, which is unique for a lot of different reasons, but I'll give you one quick example. The folks that run our probation system, which is actually part of the judicial branch in Connecticut, in the last 4 or 5 years, they've started to measure their overall rates of recidivism. And each year, it comes down by 1 or 2 percentage points. And so over 5 or 6 years, it's down by a significant amount. And in large part, that is driving a reduction in our prison numbers. We closed 3 prisons in the last year and a half. And a lot of that has to do with fewer people coming into prison, not releasing people earlier. So this is what my boss is looking for, right? Save a lot of money.
Thanks, Undersecretary. So I want to switch to the first element of recidivism reduction. There's 3 sort of things that I really want to pull out from Dr. Latessa's presentation, and we're going to keep hitting those during the breakout sessions. The first that you all heard about, risk assessment, right? Making sure that we actually are using an objective means to measure the likelihood of somebody's reoffense. And Commissioner Thompson, I know the legislature and the governor all stepped up this year and actually legislated the use of risk assessment. Could you talk a little bit about what Kentucky did?
Sure, Micah. Like almost every commissioner in the room, we've used risk assessments for years. We use risk assessments for classification. The Parole Board uses risk assessments for a risk of return. Probation and Parole uses risk assessments to determine what type of supervision that an offender needed. What we didn't use was a risk assessment to see what are the needs that the inmates have. How can we reduce the risk factor by meeting some of those needs? We had recognized that a little bit prior to session and had actually purchased a tool, and many of the agencies have tools to measure those things, but Kentucky did not. And so we spent a lot of time training our staff how to use those things so that we have one assessment that we all share, we all understand, and it goes with the inmate from the time that he comes in until the time he's released as an offender. Now, the other thing that we did not do in the past, which is also part of the legislation, is it was an internal document, but now we're sharing that with the courts, which I think Dr. Latessa also mentioned. We're sharing that with the courts, and probation and parole is also mandated to consider these risk assessments and the types of mitigations that are made when the inmates go into the programs. We've had some very good feedback from those, and I think everybody's looking forward to be able to use those, speak the same language, see the same numbers, and understand across the board what those things mean.
Right, so a statewide, system-wide sort of approach saying this is the risk assessment sort of
Right.
strategy that you're going to use. I know Pew, Center on the States, was actively involved
Yes.
in helping put that together. Director Wall, I know that when I talk to legislators and we talk about the importance of risk assessment, they tend to go over to their corrections system and they say, I spoke to my corrections folks and they say we're using risk assessment, where they assure us it's sort of informing all these decisions. So I don't think we're one of those few states that's actually sort of not doing risk assessment. And so the dilemma here is how do we sort of understand Dr. Latessa's point about risk assessment not being used in a lot of cases, yet hearing frequently from people in key positions that this is indeed being used. How do we unpack that?
I think it's fair to say that virtually all of us in corrections have come to understand the importance of risk assessment, and we agree that it's necessary and do our best to implement it. We have confidence in our risk assessment instruments, and the principle is pretty straightforward, right? I mean, you focus your resources on the offenders with the highest risk to reoffend. I will find, as somebody who runs a system, that on the ground, it can sometimes get a little more complicated than that. We have certain struggles. At the institutional level, for example, risk to reoffend and security risk, custody level, aren't always perfectly aligned. And in most systems, we don't have the resources to have the same programs at every level of custody. Custody trumps. And so sometimes high-risk people, as defined by risk to reoffend, are not necessarily going to be in the places where the programs might be found. Parole boards will release people conditional on their participation and completion of treatment. And we want to support those decisions. Cost containment is a factor for us. At the same time, sometimes the parole board wants that treatment slot reserved for the low-risk offender. And so we will put that offender through the program because that's the key to release. Waiting lists. The principle should be that if it's the highest risk of reoffense, you jump to the top of the line. But everybody knows how they feel when someone cuts in line, wherever it is. You've got, and especially in systems like ours, where participation and completion of programs is tied to credit off sentence, somebody who's on a waiting list and sees someone else jump ahead of them recognizes that means they're going to stay behind the walls longer. So we do understand. I think these are issues that can be resolved, but it's not for the faint of heart, and we really have to educate our stakeholders as to why it's not always as straightforward as they think.
So it'll be an interesting conversation in the breakouts and with your teams, essentially. A lot of people valuing, especially the corrections leadership, this risk assessment, but actually making sure it's being used in all these situations and followed the results. It sounds like you're all agreeing that, in fact, still room for improvement across the states, and a lot of this involving systems that aren't directly under the control of the Department of Corrections. Fair sort of summary?
Sure.
So a lot of legislators then say, well, maybe I should be focusing on the risk instrument that I should be using. A lot of sort of legislators become incredibly sophisticated, focusing on the LSIR or sort of the compass and sort of knowing all the different lexicon and of different instruments. Director Jones, is there a right instrument to sort of be using? Is that sort of the right place to sort of be focusing on? Or?
I don't know if there's a right instrument, but you certainly have to validate it on your offender population, and you need to do that frequently as populations evolve into different risk levels and needs levels. But it certainly should be driven by risk, and there should be some type of disrupt scale in your assessment instrument so you can measure success with pre and post assessments.
Thank you. So not necessarily what instruments you're using, but simply that it be used consistently and that it be validated.
Absolutely.
Okay. So we talked about first focusing on risk. The second element of recidivism reduction that we want to be focusing on throughout this is program quality. I won't use the opposite of program quality that Dr. LaTessa described, but everybody got the message loud and clear, I think. Commissioner Thompson, I want to return back to the legislation that was enacted in Kentucky. You all actually mandated that some of the money saved by avoiding more prison construction be reinvested in programs that actually demonstrated certain kinds of quality. Can you sort of elaborate on that?
I sure can. The legislation actually requires by June of 2012, 25% of our programs have to be shown to be evidence-based. And then 2014, we have to be at 50%, and at 2016, we have to be at 75%. So right now, we're in the midst of assessing those, and we're using all these tools that Dr. LaTessa mentioned, although I'm glad to say we can quickly, I guess, take melon thumping off the list now. But you know, using the research, I have to give a shout out to the other directors. They've been very generous to us as we get in touch with them to see what their statistics are, because many of our programs, we've been dependent for so long on the vendors and the providers of the programs to tell us what the recidivism rate is, because we didn't have a measure for it. We are putting measures in place now, and we were also lucky because the legislators did give us some funding for our electronic management system, so we can put those figures into our system and see for ourselves how they work. But it's also come to light for us during our assessment. We used some of the universities come look at the programs, exactly what Dr. LaTessa said. Even though the institutions say they have program X, they are not being presented in the same way at every institution. In fact, I'm not quite sure they're being presented the same way at the same institution in some cases. And the staff that you have who represent and present those programs to the inmates are very important. So those are all things that we're assessing right now. And as you said, going forward, as we start to see the savings that we expect to see from doing a good job with the programs, we can reinvest those to either expand the programs that we have or to put them into, like AT was saying, we don't have them everywhere, to maybe be able to expand those to the other institutions that don't have them. And we also have a community-based component that we're looking at. In the past, we've never looked at the evidence-based.
So an interesting approach, though, basically, in the legislation, you required that a certain percentage of programs actually demonstrate that they're adhering to different evidence-based characteristics, and you're using these tools to assess it. Interesting. So, Commissioner Epps, I know the refrain here is sort of these evidence-based programs, we're involved a lot in legislative hearings in different states, and I know oftentimes after we sort of leave the area for testifying, there's all these programs that are in the audience that sort of come up to you and say, I've got a great program and it really works, and this is the kind of thing that we need to be doing. And then a legislator comes up afterwards and says, that's the program I want to put my money in. That looks like something that's really good, and I'll just put it in your budget, Commissioner, and you can sort of take it from there. Can you sort of talk a little bit about the situation that corrections directors find themselves in when someone's got just the program for you and they're willing to fund it and everything else?
Yeah, I'll be glad to. I have my chairman here with me on the Senate side, Senator Willie Simmons. And he and I, we come up through the system together in the Department of Correction before he left and decided to run for legislature. But nobody here never seen a bus coming down the road with 2 drivers in the seat. And with that said, there can't be but 1 driver. And so in that, if it's not a good program, then we shouldn't be using it. We have ACA standards where we have to evaluate our programs at least annually. You can evaluate them semi-annually. And they should be evidence-based program. We all here got the same problem, that in Mississippi we bring in 800 inmates a month. Each inmate, each offender has a unique, different situation. Rarely will you find 2 offenders with the same background. And so in that, we risk them and determine those needs, and we provide those programs, which generally are educational, substance abuse, mentoring, and other programs, so they can be productive systems such as ours. But Michael, we have to be the drivers of our agencies and respectful to the legislatures. You know, that's why the governors put us here, and I would hope that's why the Senate confirms.
Great, thank you. So, second theme that we're focusing on here is program quality. We have the tools to actually assess the quality of those programs. We need to make sure that that's indeed where we're putting our money. Again, some challenges I think that everybody acknowledges that we run into in actually accomplishing that and room for improvement. Let me take the third issue that we want to focus on in terms of recidivism reduction, which is, as Carl Wickland knows, so much about that field supervision and the release decision. Director Wall, I know you're the envy of many corrections directors because in Rhode Island you run a unified system, meaning that you are in one shop, the jails, the prisons, probation, and parole, and all of those things sit underneath you. Can you talk a little bit about sort of the effort to really change the mindset of community corrections and explain a little bit about what that means?
Sure. As a guy who got his start as a line probation parole officer 35 years ago, that was how I got into corrections, it's been very gratifying for me to see the transformation in community corrections that this focus on reentry as a key to recidivism reduction has fostered. I think our probation and parole staff were feeling, prior to this new burst of energy, kind of tired. Working very hard, large caseloads, difficult to differentiate who they should be supervising, sitting in the courthouse, working essentially 9 to 5 and almost waiting for people to fail. And the challenges posed to community corrections by this new strategy have really reinvigorated them. They have stepped up. They're out of the offices and relocated into the neighborhoods. They're working the non-traditional hours. They have non-traditional partners with community leaders, service providers, victim advocates. They have relationships with law enforcement that include joint home visits, that include extensive exchange of information. And they are, I think, really feeling as if they can remember why they got into the work of community corrections in the first place. And it's had an awful lot of benefits for our efforts to reduce recidivism. one of them has been the tremendous sense of relevance and satisfaction that the staff have had.
And Undersecretary Lawlor, I know that when you were in the legislature, just setting a goal for a reduction in probation revocations really sort of helped sort of feed that sort of change in culture that Director Wall is talking about.
It did, and I can remember, this is like 10 years ago, we had a very quickly increasing prison population for reasons which we don't have time to explain, but it was very dramatic, and we brought in some folks to try and evaluate what was driving this, and it was very clear that some layoffs in probation and parole had increased the caseloads, which caused more revocations, which shot up the prison population very quickly, because in Connecticut we're also unified, so we have the county jails are part of the Department of Corrections. And at the time they said if you could just set a goal to have 25% fewer probation violations, and for the ones who are actually violated and sent to prison, if you could just knock the sentence for those people down by 25%, then you'd save maybe 1,000 beds over the course of a year. And that was the first time such a goal was laid out there, and we actually did achieve it, and we were able to reverse that quick shoot up in the prison population. But I think that was when people began believing that goals were achievable in the criminal justice world, because prior to that it was just, hey, if you do the crime, you got to do the time, and it was not more complicated than that.
So, Director Jones, when we were talking about effective supervision, I know in the video that Pew showed, one thing that they focused on is immediate responses when someone does not comply with a condition of release. We all know that corrections department, community corrections struggle with that immediate response given some of the caseload issues we talked about and other kinds of things, and oftentimes it's weeks go by before there's actually a response to a violation. Can you give the group a sense of just some challenges that field supervision runs into? I know in Oklahoma, one of the issues is, sure, we'd like to put them in, have an immediate response. It's just one day of incarceration, but the jail is full. Can you talk a little bit about that?
Yeah, I guess unlike Mississippi, in Oklahoma, there may be 4 or 5 people driving the bus. Because we're kind of we're a unified system, but then you've got private probation, you've got a new anomaly out there called district attorney supervision. You've got a lot of different things, and you've got the cost factor, where the county doesn't want to absorb the cost, et cetera. So we have all this evidence-based supervision where we're looking at the quality of the contact and not the quantity of the contact, doing the motivational interviewing, doing all the quality assurance. But then you also have the evidence-based practices of swift and intermediate sanctions, but also incentives. And incentives ought to be 2 to 3 to every sanction that you have. And then having the systemic way of getting all the different government levels to cooperate in this, especially when you have private supervision and county supervision and now district attorney supervision, is getting all of that collaboration. So when we're doing a best practice in community corrections and probation and parole, that the county understands that's a best practice and the other collaborators understand that's a best practice. And it also includes those that you subcontract with, you're outsourcing. Whether it's a treatment provider and an intermediate sanction is to up the treatment and the dosage of that treatment. So it becomes quite the complexity to get all of these people involved and on the right sheet of music as far as best practices in all their fields.
Great, thank you. And just one quick point, I also know you could actually see recidivism increase when you're actually maybe supervising people differently, and that might not be a bad thing. Right?
It may not be a bad thing, and in Oklahoma, and this is not facetious, we say everybody has the right to go to prison. And so one of the things about that is that we incarcerate, looking at the LSIR, et cetera, we use that not only in the community, but upon reception in the prison system. And we incarcerate a tremendous amount of people that Dr. Latessa would say they don't really need any dosage. They're in there for short periods of time, they're nonviolent offenders, et cetera. So in our case, if our recidivism rate were to go up, that might be indicative that we're starting to incarcerate a higher proportion of high and moderate offenders and reducing the amount of low offenders. So, tracking recidivism data at best is a very complex process, and you have to have these caveats, and you have to look at your individual cultures in your state, and you've got to start off by identifying the risk levels that you currently have.
Well, you can see why these states are so lucky to have these folks running their departments of correction and why they've been in their positions so long. It's 11:15, and what we move now to is the breakout sessions where you will be meeting with your counterparts from across the country. You heard three things that this group focused on. Number one, I think you heard agreement about goals and the utility of those for reducing recidivism. I think the second thing we focused on were the elements of recidivism reduction. We talked about assessing for risk, we talked about program quality, and we talked about effective community supervision. No one's there on all those fronts. We all have improvement to make in each of those areas. And then lastly, the importance of measuring and tracking progress that we heard from the governor's folks and the legislators. So goals, the plan, and measuring progress. Those are the three things that we're going to be focusing on during those breakout sessions. We're now going to, before we end, I just want to ask for a round of applause for our panel who did a fantastic job.